Hi, my name is Marissa Lane, and I'm here to talk about why would epinephrine not be a first choice bronchodilator in animals. So I figured I'd start talking about epinephrine. So epinephrine is also known as adrenaline, and it is a naturally occurring substance in the body, so it can be produced by your adrenal glands, but it's also used as a drug in veterinary medicine and human medicine. So basically what epinephrine is it's a cardiac stimulant. It's going to cause an increased heart rate and increased cardiac output. It's going to cause constriction of the blood vessels in the skin. It's also going to cause dilation of the blood vessels in the muscle and dilation of the bronchioles. It also causes an increase in the metabolic rate. Some side effects of epinephrine is that it will cause tachycardia, which is an increased heart rate. It also will cause hypertension and cardiac arrhythmias, and it can also cause nervousness and excitability. Usually epinephrine is used for life-threatening situations, so if you've seen doctor shows like Grey's Anatomy and things like that, they'll always say push one of epi in a code blue situation. So that's really what when epinephrine is used. Usually it's used for things like anaphylactic shock, if people have like an EpiPen, things like that, and it's also can be used for cardiac arrest. It stimulates the contraction of the heart muscle, and it also supports the circulatory system after cardiac arrest. It's usually administered by the routes of intracardiac, intratracheal, and intravenous. And some problems that occur when using epi is that it causes a lot of strain on the heart. So it's going to cause the heart to overwork, put a lot of strain on it. So it's really not used in patients with congestive heart failure. So that's really what epinephrine is and what it's used for and some side effects about it. Now let's kind of switch gears and talk about bronchodilators. So a bronchodilator is a drug that's going to open the passageways of the lungs, so it lets air flow through easier. So according to the Applied Pharmacology for Veterinary Technicians textbook, their definition of a bronchodilator is that it increases the size of lung passageways to allow more efficient oxygenation of blood, to exert a mild positive inotropic effect on the heart muscle, and to obtain a mild diuretic effect. It also talks about how there are 4 categories of bronchodilators that are used. The first one is cholinergic blockers, so these are things like your atropine, your glycopyrrolate, things like that. The second one is antihistamines. The third one is the beta-2 adrenergics, and that is where epinephrine is. That epinephrine is in that category, also pseudoephedrine and things like that. The fourth and final one is methylxanthines, which this is things like caffeine or aminophylline. So those are the 4 categories, and as you notice, epinephrine is considered a bronchodilator. So why would it not be the first choice to use in animals? Basically, it's too hard on the heart. So when you give epinephrine, the heart is going to be stimulated tremendously, and it's going to want to pump even faster. So this can cause significant tachycardia. You can get a lot of increased heart rate, and it can cause significant cardiac arrhythmias. So the heart's not going to beat in a normal rhythmic state. It's going to have an arrhythmia and cause an arrhythmia. Epinephrine is also used for more life-threatening situations, not necessarily as a bronchodilator. If you have a patient that's having trouble kind of breathing, it has more of an effect on the heart than it does on the lungs. So there are other bronchodilators that you could use that won't cause such a great effect on the heart. It won't cause the heart to overwork. And like I said before about the definition from the book, it talked about how you want to cause a mild effect on the heart. You don't want to overstimulate the heart, because really you're trying to allow the passageways in the lungs to be dilated, not necessarily the heart to beat faster. So they're much better bronchodilators to use, and you won't have such a overworking heart. So that's really why epinephrine wouldn't be the first choice to use. You could use it, but really there are much better ones that won't cause such a strain on the heart. So that's a little bit about epinephrine and bronchodilators, and I thank you for listening.